Welcome to Marian Ayurveda. In our first episode, we are going to discuss a condition known as disc, which occurs in the spine. This is a disease that most of us are somewhat familiar with, commonly referred to as disc prolapse or slipped disc. This condition affects the neck and lower back areas of the spine. For many people, this is a major crisis. This disease, caused by disc problems, can make it impossible to go to work or even force someone to resign from their job. For others, the pain or numbness radiating to their arms or the weakness in their legs can create a significant crisis in their lives. Disc problems are indeed a serious disease that can have a major impact. We know that all the changes in lifestyle and dietary habits of the present era have contributed to this condition. I am Dr Anumod Kakkassery, Marian Ayurveda, Thrissur. When we look at our treatment methods, disc bulge is one of the conditions where we see the most results. No matter what stage the disc bulge is in, we can observe good results. We know that there are 3 to 4 stages of disc bulge. First, there is the disc bulge, then the next stage is called disc protrusion, and then disc herniation. These are the 3 stages we encounter. We have often seen patients who were brought in unable to walk or completely debilitated, later able to walk again with good results. I have been treating disc bulge for the past 20 years using this kind of therapy. One of the major difficulties we always face with this disc condition is that many people, due to lack of awareness or after seeking out fake treatments, they say things like, just walk it off, or suggest treatments like stepping on the back or applying herbal poultices to those with disc bulge. It is when such treatments are done that the biggest problems arise. We know what a disc is. We also know that the spine contains many yellow-colored nerves. This area here is what we refer to as the outer part. If we press or massage here, when excessive pressure is applied, or when poking with herbal sticks, significant complications and serious problems can often arise in these delicate nerves. And the underlying spinal disc condition can worsen even further. So what we always need to keep in mind is that the most important thing is to never undergo such risky treatments. From unqualified people who do not have a comprehensive and professional understanding of human anatomy. When we talk about a disc problem, we can see that the disc lies like this washer. The reason for a disc bulge is the loss of water content in it. For example, when a plant is fresh and green, it bends and twists easily. But when it dries up, it becomes brittle and breaks. Similarly, if you look at an MRI, you can see a similar condition in the disc. It is possible. A dehydrated disc means that it has lost its water content. We know that when there is moisture, for example, if we pinch our skin, it will spring back out when we let go. Similarly, the disc pushes out and then returns inward. But when it loses its water content and dries up, it doesn't behave this way. So if we look at an MRI, we can clearly understand it. L4-L5, L5-S1, or C6-C7, these are the common areas where disc bulges occur. In all these places, dehydration or loss of water content happens. This is the only disease. When pressure is applied to those nerves, it causes pain, numbness, or tingling in the legs or arms. Now, when we talk about treatment, what is meant by treatment is that the oil essence is the substance inside the disc that has lost its water content. The only thing that is considered treatment is to provide this oil essence. So, from my 12 years of experience in treatment, what we have developed and understood is that according to the MRI, we treat only those discs that are affected. What we do is, at a specific temperature, we inject the oil in a special way into the affected discs. We gently infuse it like a slow stream directly into the discs, and at a particular temperature, we treat only where the disc is bulging or protruding. Often the pain radiates to the leg or there is numbness in the leg. Simply draining it out does not provide any benefit. When we talk about our illness, it is only in a small area. Regardless of which disc it is, the problem exists only there. So if the instruction is not to apply pressure there, that is a very important point. Now, when we apply this type of oil at a specific temperature to different parts of the disc, it is over these 9 days that we call the traveling time. That is, even if it is applied externally on the lower back. We generally observe the time it takes for the oil to reach the disc. It usually takes about 9 to 10 days to reach there. By doing this, the oil reaches the dehydrated disc and helps it return to its original state, as we can see from the MRI reports. That is, before the patient comes in, we first take an MRI. After 2 or 3 months, when we repeat the MRI, we have often been able to see in many MRIs that the herniated disc has moved back inside. So with just this one treatment, the oil reaches the dehydrated disc. At the same time, the second aspect is to treat the underlying cause of the problem. The cause refers to the underlying issues present in that condition. In the majority of people who develop disc bulge, they often have acidity problems or experience indigestion after eating. Such problems are common. Only when these digestive issues are resolved or when stomach-related problems or acidity issues in the stomach are addressed can we prevent the recurrence of disc bulge. So this is how the treatments are approached. Sometimes during the course of this treatment, there may be people who are reluctant to take Ayurvedic medicines or disc capsules. The specialty of this treatment for such individuals is that there is absolutely no need for any medication. Through the sternal therapy that we perform, we can deliver the oil components directly to the disc and help restore the disc to its original state. Similarly, for those who have excessive acidity due to their diet, it is absolutely essential to control foods that cause acidity. We will meet again in another episode. Thank you.